Welcome, Dr. Reidy.
Well, thanks for having me, Toya.
How's everything?
Very good. A busy time in the emergency department, but we're used to it.
Okay, well, tell us a little bit about what you do in the emergency department.
Well, I'm a board-certified emergency physician. Spent the last 35 years practicing full-time emergency medicine here at McLaren Macomb. So we're used to taking care of emergencies, and especially during the summer where things get a little more active, people are more active, and they're outside, spending more time outside, and at the same time they're at risk for injuries and illness that are unique to the summertime.
Okay, and I'm sure parents are eager to get the kids out of the house, and kids are eager to get out and play. And so do you find that you see a lot of children in the emergency room in the summer?
We do. We tend to see more, fortunately, mostly minor injuries in the emergency department. Because kids are not in school in a controlled environment, they tend to be outside, running around, playing around, swimming, and they're a higher potential for injuries.
What kind of injuries?
Well, fortunately, most of them are minor, cuts, scrapes, falls. We always emphasize when kids are out riding their bikes to wear helmets, because that's where a minor fall can turn into a major problem when a significant head injury. We're also very concerned during the summer about drowning and water-type illnesses. The drownings are just so tragic. It's the number one cause of death between the age of 1 and 5. And surprisingly, drownings occur most of the time in the presence of two caregivers or two parents. So
How do you think it happens? What do you think?
Well, they've studied
high numbers.
They've studied this, and those of us that are parents know that when two people are watching a toddler, sometimes you think the other parent is watching, and the other parent thinks you're watching, and the reality is no one's watching.
Right.
And it doesn't take very long for that 2 or 3-year-old to slip out of your sight, get in a pool, and you don't hear anything. That's why they call it the silent killer. So we always emphasize to parents, especially when during the summertime, that when they take their kids swimming, to leave their cell phones at home or away.
Focus.
No reading material, to totally focus on the children in the water. Don't be distracted. If there are two parents, have a clear designation of who's watching those kids. And that really cuts down on the number of drownings.
Yeah, and I'm sure in smaller pool settings where there are lots of kids in the pool, it's easy for a kid to get caught under the water or
Correct.
things like that to happen.
You're absolutely correct. And majority of drownings occur in residential pools.
Wow. Yeah, well, that's some great advice, for parents to come to that environment very focused and clear about who's doing what, who's watching the kids at the time.
All of us emergency physicians have experienced a young toddler that has drowned, and it's just etched in your mind the pain that those parents have to endure. We just never want to see it again.
Yeah. Are there other injuries that you see that are pretty prominent in the summertime? Like, especially, we've had quite a few really hot days this summer in particular. Is that a threat for children?
Yeah, that's a good point, especially when the weather gets warm like this. We have to be mindful of what the temperature is going to be, what activities we're going to be engaged in, and plan appropriate. We do see heat illness, heat stroke occasionally.
In children?
More so in adults that are out working on the road, especially road workers that are in construction, that may exert themselves too much and don't drink enough water and don't get out of the heat, and they end up with heat illness, heat exhaustion, or heat stroke.
I know that Powerade and Gatorade are popular drinks for hydrating. And is that really the case?
They are very popular, and I think they're okay in small amounts. I think what's much better is water and supplementing that with a small amount of the Gatorade or electrolyte solution drinks. But you don't need to constantly drink Gatorade or these sports drinks, because they do contain a lot of fructose and a lot of caffeine, some of them.
Things that dehydrate you.
Exactly, exactly. So I think water is best. However, a small amount of the sports drinks are fine too.
And so if someone is affected by the heat, is it noticeable if I'm with a child or with an adult or a senior? How would I know that there could be a problem happening?
Well, it's kind of a spectrum of illness. The first signs are you start feeling tired. Okay. And you notice that in kids, they're just not as active as they should be. In adults, they may be less conversant. Then they start to see where they don't sweat anymore. Usually our response to heat is to have perspiration. When they start not sweating, then the cooling mechanism doesn't occur and their temperature starts to rise. And when it's really serious is what we call heat stroke, is generally in a setting of a core temperature of the body over 104 degrees, that a patient starts to feel neurological changes where they're a little confused or they're disoriented. That's where it's a true emergency and they have to be removed from the hot environment they're in and initiate cooling therapies as well as hydration.
And cooling therapies meaning just applying cold compresses, or are there some ways to quickly cool the body?
There are.
That are safe?
Correct. In the pre-hospital setting, the most important thing is to get them out of the sun, to get them out of the hot environment, get them in an air-conditioned setting, and then offer them cool liquids. And like you described, cool compresses until we can get them to a setting where we can monitor their core temperature. If their core temperature's 104, 105, 106, these are medical emergencies that warrant rapid cooling. And in the emergency department, we may put a wet sheet over them and cover them with ice to rapidly bring down their temperature.
And at the point that it's determined that the temperature is that high, then call 911 and get to the emergency room.
Absolutely. If they're showing neurological signs of confusion, disorientation, they're just not themselves, especially in the elderly where they may be taking medications that affect their ability to cool themselves, they need to be seen quickly.
And this might be a really simple question, but I'm curious. We see so many sunscreens on the shelf, now ranging up to 100 SPF. What's a good number, to protect the skin and to avoid skin cancer or, things like that, or burns that would cause a need to come into the emergency room?
Well, I think the most important thing is, one, use the sunscreen. You can buy all these spectrum from 30 to 100. The most important thing is apply it and apply it regularly. Number two is to protect yourself from the sun. Don't get in that direct sunlight for long periods of time. Certainly we're all active. We're not always going to put a hat on or sun umbrella or anything like that. So we're going to get minor exposure, direct exposure to the sun. However, if we know we're going to be outside for long periods of time, then we should wear a hat or wear a covering our skin so it doesn't get that direct sun exposure. But to say, you absolutely have a 50 or 75 or 100, I think it's more important to use it regularly. And if you're going to be out in the sun for long periods of time, cover yourself with a hat or appropriate covering for the setting you're going to be in.
Okay. And what's a good amount of water to take in? Is there a standard depending on your size or amount of activity, or?
As a rule of thumb, I think you should, like we talked about, drinking water, small amounts of sports drinks are fine. But also, when you start to develop thirst, that tells you that your body needs a little more fluids than you've been taking in. So listen to your body. When you start feeling weak, when you're thirsty, stop your activity, get out of the heat, drink appropriate amount of water. If you feel good, continue with your activity. I guess it's more common sense than an absolute formula.
Okay. I've heard, I've read before that half your body weight in water is a good amount for you to take. I'm not sure if that is just, you know.
Yeah, I think I'd go more, have it symptom driven than an absolute volume amount.
Got it.
I think it's easier to follow because who keeps track of how much water we're drinking? You're active, you're distracted, you're with kids and whatnot in the summer. So it's hard to kind of quantitate those things to make sure you're on track with your fluid intake. But if you notice, boy, I'm getting tired, it's been an hour since I had anything to drink, then listen to your body and take in some fluids.
Okay. And one last set of questions regarding kids and head injuries. Falling off of bikes or climbing trees or jumping off of the garage roof, the things that kids like to do. How would a parent know when it's time to bring a child into the emergency room? Because sometimes we'll look at a fall or a bump and just, watch the children for a little while to make sure that, they're okay. But when should we be alarmed?
In a general rule, a toddler that falls from standing onto a hard surface generally is not going to suffer a significant injury. That said, I've always said if a mother's instinct feels their toddler or their child's injured, follow your instincts. If you think, boy, they're just not acting right after that fall, get them checked out. We can go through them thoroughly in the emergency department. Fortunately, most head injuries that occur in the younger age group are minor, don't result in serious head injury, and don't require CAT scan imaging or skull x-rays. It's important to try to get as much information about the fall as possible. If the parent didn't witness it, try to contact the kids that were with them or other adults to get a sense of the energy that the child absorbed in the fall. Certainly falls from ladders or heights or garage off roofs, those need to be investigated. But minor falls from standing and most falls off bicycles and things like that generally are minor and don't result in serious injuries.
Okay. Well, thank you so much for the information.
Well, thanks for having me.
This has been very helpful to any of the parents watching. We appreciate your time.
Thank you.
To learn more, visit mclaren.org/Macomb Safe Summer.